Ladies and gentlemen, live from Studio A at Argentum Studios in North Hollywood, California, you're watching Talk with PhillyG!
Hey, look at that. It's me. You're watching Talk with PhillyG, and I'm PhillyG. Thank you. We have a great show for you today. We have Dr. Bill, right?
Right.
You want to say your whole name, or can we just go by Dr. Bill?
Yeah, Bill Honigman.
Yes.
It's the last name.
Thank you, Dr.
Thank
Bill
you.
Honigman. We are very grateful to have you here today. I would like to say thank you to Luca for the great introduction. As always, sometimes I don't say it, but I always mean it. Right?
When you do say it.
Yeah. Well, even though we don't say I love you sometimes, we still always feel it. But it's always good to say it, isn't it?
That's right. It's therapeutic.
Yeah, for sure.
Yep.
Well, thank you for coming today. It is not a short drive. You are all the way in Orange County.
Woo.
For people who don't know, in Los Angeles, we are not a metropolitan that is close by, right? It is spread out. And if you're in North Hollywood, California, where we are, Orange County is quite a distance away. It might be like 25 miles, but with traffic, it's like 95 miles.
Oh, yeah.
Thank you for coming up.
Oh, my pleasure.
So we brought you up today. Well, first of all, I met Dr. Bill at Bernie's coffee shop the other day, right?
Yes, you did.
And the occasion for the coffee shop event was that the coffee shop kind of reopened. It's been there for like 4 years since Bernie Sanders, the presidential candidate, ran his first time in 2016. Mm-hmm. The owners, the Gold family, as I found out, they opened a coffee shop in Bernie's name and to support his cause. So the first time around in 2016, he was not successful. And so they reopened it, and it's on Fairfax and Wilshire, should you want to go there. And you could support the cause, or you could go to @Bernie's Coffee Shop on Instagram or anywhere else if you're interested in that. But we are interested today to speak with Dr. Bill. And we are going to talk to you about several things, right?
Yeah.
We are going to talk to you about, the PDA, the Progressive Democrats of America. We're going to talk to you about Bernie Sanders. We're going to talk to you about the climate emergency. We'll speak about Medicare for all. And finally, we'll find out from you if we should be super scared or not super scared about the coronavirus. Maybe you can just educate us a little bit about that.
Sure. Happy to.
Yay. So number one, why don't you just generally introduce yourself? You used to be a physician at Kaiser Permanente.
Yeah, yeah.
And where are you from? Where are you from generally?
So I grew up on the east side of LA, kind of Monterey Park, Montebello area. Okay. My father was a family doctor,
yes,
and I guess it rubbed off on me. His practice was right in the heart of East LA, and he stayed there as the demographic changed and became more and more Latino. And he learned Spanish, and I helped him out in the office growing up in high school, and went on to med school. To me, it was more exciting, I guess, to work in the emergency room setting. Probably not the adrenaline rush that everyone thinks, as much as I'm kind of a fix-it kind of person. So I always enjoyed the challenge when people came in with an emergency condition of some kind or other, to see if I could help them get through that, at least facilitate what they had to do to take care of the problem overall. But that's kind of on my medical side and growing up side. Also growing up, I was into politics. So I would walk precincts. I was an anti-Vietnam War protester in junior high. I walked precincts for Eugene McCarthy because Bobby Kennedy wasn't anti-war enough for me. So, so that was junior high school, and I've been involved both inside and outside the Democratic Party ever since. Nowadays, we're seeing this confluence of politics and healthcare coming together.
Sure.
And, we're looking at climate as being an existential threat, meaning our existence on the planet. But your personal existential threat is healthcare.
Sure.
Because if you don't have healthcare, you aren't going to survive. So, as you mentioned, I organized with the group Progressive Democrats of America. We work both inside and outside the Democratic Party, and I do that as what we call a state coordinator, where I try to pull more and more people throughout our state into the organization, and I also do that for our healthcare human rights issue team nationwide. And so I'm a moderator of a monthly webinar that we do with PDA Healthcare, and folks can even see that. You can pull it up on YouTube. If you go to PDA Healthcare, you can see
them right there.
Yeah. You can catch our monthly webinars. They're all archived there on YouTube. So
it's the Progressive Democrats of America website.
Healthcare.
Oh, say again.
Progressive Democrats of America and Healthcare, and that will pull up all of our webinars for our issue team.
Okay, so the webinars are politically minded, or are they?
Oh yeah,
healthcare
very
also?
much so. So a lot of groups are strictly about their issue. Ours always has the political implications. So if it's a candidate who supports, healthcare as a human right, like Bernie, for example, then we will talk politics, partisan politics, and especially electoral politics on these calls and webinars.
Yeah, that's interesting. So I would like to ask you about morality, and there's ethics, and there's morality, and there's medicine, and I feel like that's a very strong, a sentiment with you being moral and treating people in a way that they should be deserved. Perhaps I don't even like the word undeserving. People who don't have resources, right? Some political parties say, hey, you're on your own. You're not part of our club. You're not a citizen. You're not part of our group. Therefore, you don't deserve medical attention.
Yeah.
Right?
Yeah. Well, it's interesting because we're in Black History Month, and we just celebrated the life and birth of Dr. King.
Of course.
And this kind of interfaces with the campaigns that we're seeing going on right now for president, where you have the leading candidate, and we're about to vote, here in California, but the leading candidate is a self-described democratic socialist.
Sure.
So what does that mean? If you took Dr. King's definition, it might go something like, if he had stuck around long enough to see what's going on, is that it's immoral to profit off of a condition of human need. Right. That when there's profit making going on in healthcare, education, say with charter schools, that whole issue, the environment, why aren't we doing the right thing, for our people, all of our people? There seems undisputed fact that we are the wealthiest country in the world. So why are all the other advanced countries in the world taking care of all of their people when we don't? And that's because we've put up with, corporate welfare.
Sure.
Like Dr. King said, we have socialism for the rich and rugged individualism for the poor.
Right.
But I would contend it's not about, some center-right, center-left version of politics. That's incredibly linear thinking.
Sure.
And what it is about is, what do we all have in common? What do progressives have in common with the Trump voters? And that is that we all would like to have clean air, clean water. We'd all like to see our kids do better in life than we did.
Yes.
And we would all like to see nobody suffer because they couldn't afford to see a doctor. And those are not, center right, center left issues, or like we say, it's not about right versus left, it's about right versus wrong.
Right. And I would say that in the discussions I have personally with some of my friends who might not share the same viewpoint, I think there's a commonality that we all should have, right? A decency, a morality, a spirituality that we all should share as Americans and as human beings.
Yeah.
Right?
Yeah.
But for some reason, people, I think, and I could be wrong, they take the American dream and they equate the American dream as some kind of materialism, right? The American dream is the big home, and the toys. But in fact, I please speak to this. That's quite a fallacy, and the American dream is something quite opposite of that, isn't it?
Yeah. So Paul Wellstone, the late Senator Paul Wellstone from Minnesota, he used to say, here's another definition of socialism: we all do better when we all do better. So why aren't we, if anyone thinks that, gee, I wish I was doing better, why aren't they saying, well, let's all do better so I could be doing better too? I mean, it's really, that's the attitude that Canadians have. I mean, if you know any Canadians, they will tell you, hey, I don't mind chipping into the system as long as I get what I need when I need it too. So
Sure.
They're all doing better as a result.
So you're speaking to an underlying understanding of what life is about among some people, conservatives, right?
Yeah.
I'm going to succeed because I'm working hard to succeed, and you're on your own. Like lazy welfare people, right? Everyone else, like I got mine, you got to go get yours.
Yeah.
I mean, what's that?
It's incredibly short-sighted. So, so like, for example, good luck building your own bridge. Good luck maintaining the highways.
Sure.
Good luck, if you have needs of a fair judicial system. These are all socialized for a reason.
Sure.
There are things that we all need in a society, in social settings. We need all of those things. The basic communication, basic, information sources and entertainment sources are all things that we all need. Sure. So if we apply that to everyone, guess what? You're included too.
Right. So you're saying generally it's an unspoken truth that within our society now there is a capitalist aspect and there's a socialist aspect. There is socialism within our country, and it's not scary. And you are very lucky that we have it, because without it, you would not have your basic needs fulfilled.
That's right. I mean, the military is 100% socialism. That they have, they're owned and operated and run by the federal government or state, if it's a state national reserve. So these are institutions that we all recognize as something we all need. And so why is healthcare treated any differently, would be a question that I have as a healthcare activist and advocate. It should be exactly the same. I mean, for example, you don't stop at a red light or go depending on how much money you have. Right? When you're on the street.
Well, we're in LA. Right?
They don't care at all.
Right.
But the risk you run in running a red light doesn't matter how much money. It doesn't matter if you're Mike Bloomberg, you run a red light, you're going to get hit. Right?
Yes.
So the red light's there for a reason.
Yes.
The human body, everybody's gallbladder is green. This curious little punching bag that you have underneath your liver, it's green. It is bright green. So we should all have the green plant. No more bronze, silver, we should all have, because the human body's all the same. We all have skin in the game because we all have skin.
Sure. Right. I like it. And so here we are with this concept. We're kind of moving down the list. We're going to skip over Bernie. We're going to go to Medicare for All because that's the topic we're talking about right now.
My favorite topic.
Yeah. Well, so really what people are concerned about is, it's a fallacy. We talk about fake news and all this kind of stuff. I'm not even talking about Donald Trump's version of fake news. I'm talking about like the MSNBC, the CNN, like just the junk food news version of fake news that says you don't want to give up what you don't even know you have, right? We can't have Medicare or, national health because you're going to give up something that you don't even know you're using. Most people don't even know what all their health coverage is, right?
Yeah.
They don't use it. They only use what you need at the moment.
Yeah.
And so there's a lot of reasons why I like Medicare for All, but generally for the population's concern is there's basic needs that you want covered. When you get sick, you want to go to the doctor. You don't want to go bankrupt because you broke your leg or you fell down or your appendix, right? You don't want to go bankrupt over that.
Yeah.
So there's a trade-off, isn't there?
Yeah. I mean, there's two 75% numbers that I like to tell people about. Okay. So Barack Obama, rather famously, 2009, he said 75% of people like the insurance that they have. Well, that's actually a very kind of jaded statement, because the other 25 are the ones who need to use their insurance and are finding out that it's not such a good thing.
Right.
So the other 75% is even more shocking, which is that the number one cause of bankruptcy, personal bankruptcy in America, is medical costs.
Yeah.
Okay, 75% of those people who had to declare bankruptcy had insurance. The vast majority of them had insurance, and it wasn't there when they needed it. That is called underinsured.
Sure.
So there's the uninsured and the underinsured, and that, you will lose your home.
So
you
it
will
didn't
potentially be
cover
on
the
street.
condition that you fell ill with.
That's right. It's all in the fine print. So, I know a guy, I met him once, but he was the he was the head administrator for the Center for Medicare and Medicaid Services for the country.
Sure.
A guy named Donald Berwick from Massachusetts. And he once said, he said, I don't understand my insurance policy. He said, I don't see how anyone could understand their insurance policy.
Sure.
I mean, it's so filled with fine print and gobbledygook that none of us should feel secure that if we have a truly significant and costly medical need, that it's going to be there for you.
Right.
Yeah. And that is actually extortion. So it's fraud, because they represent it as being something that will cover you. But it's also extortion because they want you to buy more and more and more of this faulty financial product just in case kind of thing, right? So people brag about being double covered. Oh yeah, my spouse and I both have different plans, and one will kick in where the other doesn't. And, that's a mafia model, a business model. It's like, hey, that's a nice kid you got there with allergies. Be ashamed if something happened to him and you didn't buy our overpriced EpiPen or, double coverage on your insurance. It's that bad. It's waste, it's fraud, and abuse is what we have right now.
Right. And so the proposal is there's several proposals. Number one is, let's take Medicare that we have now. It's for 65 and over, right? Mm-hmm. And let's reduce the age.
Yeah.
And just drop it down to 45, right?
Yeah.
Isn't that one proposal?
Well, it's a little more than that, because the Medicare we have right now has actually been perverted over the years since what they passed in 1965, and LBJ signed into law back then for seniors. And you realize at the same time, Canada got it for everyone, when we just got it for seniors. But that's what we refer to as traditional Medicare. During various Republican administrations, and just, in modern times, like since 2000, the George W. Bush administration actually added a whole lot of privatization, or what we call profitization, with the advent of parts A, B, C, and D, in Medicare. So that has included a supplemental, which seniors have to come up with, and this pharma donut hole that people fall into. Right. So when we talk about lowering the age of Medicare, we're also talking about getting rid of that, that part A, B, C, and D stuff, and just going back to simpler traditional Medicare with actually adding additional benefits like vision, dental, long-term care. Those are not in the current Medicare. So we lower the age, but we also expand the benefits of Medicare. That will include more people and give you more, coverage for things you need, like dental. Since when is dental not a part of the human body, right? Why is it not included?
I agree with you.
So, but there are incredible savings, and it ends up costing you less when you get rid of all these third-party insurance companies, and you gain the ability to bargain down on drug prices and medical devices. That's the way it's made affordable, and actually there's money left over even after all that additional coverage. So yeah, we're talking about reducing the age. Bernie Sanders talks about the first year going from age 65 to 55, second year 55 to 40, down to 45, third year 35.
Progressive rollout.
Right. And that way, over 4 years, then we'll have everybody on board.
So you are a former Kaiser Permanente physician.
Indeed.
So would would Kaiser disappear? Would United Health disappear?
I've heard that.
I don't know.
I think it's a lie. And I'll tell you why. So Kaiser Permanente is really two entities.
Okay.
It's Kaiser and it's Permanente.
Right.
And the Permanente part is the part I was a part of.
Okay.
That you could think of the P in Permanente as being physicians.
Okay.
So that is a physician partnership, two P's.
Okay.
Physician partnership
Sure.
is the Permanente side.
Yeah.
That's what they call a group model practice. So we as a group decide, we sit down and with teams and committees, decide on best practices.
Yes.
Now that's actually a really good business model. And in particular for an HMO. Remember what that stands for? Health Maintenance Organization. So the teams sit down and figure out, how do we keep people healthy? What are the good drugs and other treatments that are going to, keep them healthy, not make them worse, especially with complications and side effects and that kind of thing. So it's a group model practice that's very effective for their mission, which is to keep people healthy.
Right.
On the other side is Kaiser. And that's the not so good side. It actually controls hospitals, nurses, other staff, which is good. But it's also the business side
That's the
of Kaiser.
administration.
And very importantly, an insurance company.
Right.
And what's happened with Kaiser Insurance over the years is they also have been corrupted and perverted with business models that go against the original practice model.
Sure.
Which is that, for example, in order to market to large employer groups, since most of our insurance, across the country is tied to employers, to market to those large employers, they've had to introduce these what they call skinny plans that don't have as much coverage, that have a significant deductible, co-pays, which end up just making people angry. Like when they came to see me in the middle of the night and had to pay $100, they would be angry. That's not a good thing to have.
Right.
You're trying to be on their side, and yet they're angry because when they leave, they're asked for $100.
Sure.
So and the deductible is even worse. I would have people refuse tests and treatments in the emergency room. They would walk out on me because of the promise to them that they would be billed X number of thousands of dollars for those tests and treatments. That's, again, against your business model. How many of those people are then going to die? Say you lose a Kaiser member altogether if they died because they didn't get the ultrasound that would find the blood clot in their leg because it was going to cost them too much money. So that's been the problem over the years. It's a great practice model, but a lousy business model. And Medicare for All would clean that up for Kaiser too.
So it might take away the K and leave the P. Is that
exactly.
right?
Well, the K becomes, Kaiser does a lot of billing of Medicare too.
Sure.
Right? Medicare is a single payer, for seniors.
Yeah.
Lots of seniors belong to Kaiser. So that part of the K, of the Kaiser business side, would be fine. That would be, that would be good.
Sure.
But unfortunately, if you had too many people come in, kind of top down, management types who are so-called experts on market share and, and introduce all of these business terms, and the rest of the organization says, yeah, I guess we got to do that. We got to sell those bogus financial products, and that's Medicare for All will clean all that up.
Sure.
Yeah.
It takes away a certain incentive to sell people what they don't need, right? So the I don't want to get too deep into it because it's not all that interesting, perhaps. But there's a lot of people out there who are like, you're going to take something away. No. Yeah. In fact, you're going to get more of things that you need and less of the things you don't need.
That's right.
And the government, I'm just going to tell our crew, we're going to go over a little bit because this is pretty important. I think people want to know about this stuff. Right? So Kaiser, the Kaiser part, the administration part of United Healthcare and Kaiser and everybody else, they would be invoicing, not us, but the federal government.
Yeah.
Right.
Which they already do for a large number of their members, the older members who have Medicare.
Right.
Yeah.
Well, I get my, yes. And so it's just an expansion of that. And I think that, everyone's like, hey, Bernie, explain how you're going to make this happen. Where's the money coming from? Well, it's already there.
Yeah.
And I think what Bernie says, and believe me, I'm no Bernie surrogate, right? But what he's saying is, well, we have to tax businesses that aren't really paying that much in taxes. We're going to have a small tax in Wall Street. There's money out there to pay for this plan. It's really a question that you have to ask yourself. What are my values? Is it worthwhile for me as an individual to pay a little more in taxes? I guess in federal income tax, that would go up somewhat, right? But yet I don't have to pay any more co-pays. I don't have to pay any more deductibles and all that kind of stuff.
Yeah.
Businesses, I'm a business owner here. I'm going to pay perhaps more in business tax to cover, everybody. But yet I won't have to pay the individual premiums for everybody. So that's going to be, just from me, this is Phil talking. Phil Goldner, owner of the Harmon Press Argentum and A&I. I'm telling you out there, if I could be relieved of the burden of paying the monthly premiums for all of my employees, I could reinvest in my company. I could pay higher wages, Ed, Paul, too, right? And that's an engine for economic activity.
Absolutely.
Right?
Yeah.
And so people are afraid of it. I don't know what everyone's afraid of.
Yeah.
I think they just don't know I think it would be great if you could describe better how that transition takes place.
Yeah.
But I think when you say, like we're discussing right now, everyone, Medicare is already there.
Yeah.
We're just going to drop the age a little bit over time, and then everyone will be covered, and you're going to get more than what you have right now.
That's right. And I always say there is no insurance plan that has better benefits than what we're talking about.
Sure.
When it includes dental, vision, long-term care, all emergency services, mental health, alcohol and drug rehab, the list goes on and on. And
you know how much it costs for an ambulance to come and pick you up?
Yeah, ambulance included too. So that's on the one side. The other side is to look at it as savings. Sure. We're actually saving money. We don't have to look for new revenue sources. Like you mentioned, what about taxing the wealthy for this, for healthcare? I would say you don't have to. Let's tax the wealthy for better schools, for our housing crisis, for renewable energy source, conversion to renewable energy, okay? That's where you need an investment. But right now, we're overspending on healthcare. And what you'll see, both as an employer and as an individual, is relief in your pocketbook. Most people will see a raise of thousands of dollars a year because it's not going to healthcare. If you have it, as
Could you look in the camera and say that one more time, please. Look right there.
Yeah. So we're talking about on average, most people pay about $10,000 a year per person. Now, sometimes you get a better family deal, right? So it might be $30,000 for a family of four, or $25,000 even for a family of four. But on average, most people are paying $10,000. With Bernie's plan, that goes to $2,000. That's an $8,000 a year pay raise you just got by voting for Bernie, in this case, and Medicare for all. Elizabeth Warren has tried to sweeten the deal by going to the wealthy, and she's invoked her wealth tax to pay for that. Okay, and she said you will pay zero when you're now paying $10,000 per year. She's saying you'll pay zero under my plan because I will tax the wealthy for that and use her wealth tax. So I would say you don't have to in healthcare, because most people would say, I'm going from $10,000 to $2,000. Yeah, I'll take that deal. And we can use the wealth tax for other problems, pressing problems even that we have.
Yeah, and I think there's certain harbingers of scariness, if you will. Like, what if the government, and I know it's been brought up before, they decided to tax you for your benefits that you're getting, which is the health care, but I pay on behalf of my employees a certain amount of dollars, right, every month?
Yeah.
Well, what if the government says, you know what, that's really income for you, isn't it?
Yeah.
And we want to tax that.
Yeah. Well, it's kind of like, why should we have corporate taxes at all? And why do we tax corporations? Well, corporations use governmental services, right? So, what corporation could survive if we didn't have adequate roads, adequate infrastructure, with utilities and all of that? So, so the same is true here. Corporations will benefit, like you said, tremendously
Yes.
by having Medicare for all, by having, the people paying for it instead of out of your pocket directly. So should you chip in something? So the other side of that same coin
Yes.
is what are employers paying, because there's generally an employer contribution, unless you're one of these companies that are too mean and nasty to not even exist, in my opinion. I don't have to name names. Probably most people know that they tell their employees to get on Medicaid or or food stamps. They're not willing to pay a livable wage either. But employers currently are contributing almost as much as the employee. So when I said $10,000 a year from an employee, it's probably close to that, if not that much, from the employer, about $10,000 a month. So if Bernie comes along and says, hey, as an employer, how would you like to pay $2,000 a year for your employee instead of $10,000 a year for you? Are you?
Yes, please.
Sign Phil up for that one.
Yes, for sure. Tomorrow.
Yeah, tomorrow. So this is a huge break for businesses. It's more income for the business, as well as more income for the employee. And that's a very sweet deal.
And if I could say, like, the trickle down theory is bullshit, right? I don't need your crumbs. The trickle down, like, nothing's trickling down to poor people, right?
Right.
Rich people getting all the money, and we have to depend on them to give us crumbs is a fallacy. It ain't working.
Yeah.
But if businesses in general could save that money, and like I said, reinvest in equipment, reinvest in a van, reinvest in
startups,
modern technology.
business startups. You want to start. So small business is supposed to be the backbone of the economy. Small businesses can't start out because they don't have healthcare for themselves or for their few employees.
It's a tremendous burden.
Business startups,
and that really is a turbo economic growth generator.
Absolutely. Right. I mean, our manufacturing businesses have been offshored, to countries that have universal health care, like Canada. I mean, how many cars they make in Canada and Mexico now because of that, because healthcare then is not a competitive disadvantage. So we have put businesses at a competitive disadvantage.
You're not kidding.
Globally, by our practice. And I tell people, this is not pie in the sky.
No.
It's Marie Callender's pie. If you go to, right now, a third of every healthcare dollar is going into somebody's pocket, into a profiteer, a corporate profiteer, which is the immoral part, right?
Yes.
But it's also just dollars and cents. If you went into Marie Callender's and bought a pie, and when you got home, you opened up the box, and a third of that pie was gone, would you be pissed?
I would be.
Yeah. So that's what's happening with our healthcare right now, is a third of our healthcare pie is being stolen from us. All we're talking about is recovering that third of every healthcare dollar and actually putting it into what, nurses, doctors, technologists, what we all do, actually providing the care to people. It would be a tremendous boom to the economy, as well as for business, specifically, and individuals, communities.
I wish in the debate someone would just speak clearly and plainly like this.
Yeah.
And then you get all these other people and you're like, I don't know what you're all talking about. You're throwing darts at everybody and all this confusion.
It's a yell fest.
Yeah, right? And that's just ridiculous. Okay, we could talk about this forever. I love talking about this with you, Dr.
That's fine with me.
Right?
My favorite subject.
Well, yes. I'm not sure if our audience is bored and have tuned out. If you tuned out, you missed, because this is super important. The primary is coming up March 3rd. You could already vote now, by the way. The polls are open. Go to cavote.org to find your polling place and vote. Like, I don't care who you vote for, but vote.
Yeah.
Participate in our democracy, because there's nowhere on earth that is as fortunate as we are in that sense.
That's right.
Right? But I want to move off of that, and we're going to cover one more topic if we can.
Yeah.
The coronavirus.
Yeah.
It's scary.
Yeah.
I'm scared.
Yeah.
I thought that the coronavirus, if you get it, it's going to attack babies and sick old people and they die, but it doesn't seem like that's the case.
Yeah. So, usually at flu season, I talk about what you can do to prevent yourself from getting flu. During the summer, we have heat, so it's like, what can you do to prevent heat-related illness, dehydration, that kind of thing. But this actually ties in with our last discussion.
Okay.
Because what is the best defense against a pandemic?
Tell me.
Universal health care. Okay, it's kind of like these environmental exposures that people are getting. Like in our, here in LA, we have what we call the Alameda Transportation Corridor that goes from the harbor to downtown.
Yes.
All along there, people are being exposed to these chemicals, refineries and other businesses that are situated.
The 710 freeway.
Yeah, exactly, Long Beach Freeway. And that's what we call environmental justice, and where it intersects with healthcare justice. Guess who lives in those areas?
Poor people.
Poor people, exactly. So it's really ethnic cleansing is what's going on.
Sure.
I mean, our best defense, I know an activist in that area. She's kind of an Aaron Brockovich type person, who has studied all of the various exposures and things. So our best defense against any kind of exposure, whether it's toxic or in this case infectious, is a universal healthcare system. And by that, I mean all the care for all the people. Sure. And what you don't want is people walking around who haven't had care, who don't know what they need to do to prevent exposing other people, let alone themselves, to viruses like this one. So this one certainly sounds like it's more toxic, more lethal than say our typical flu bugs, and so people ought to take extra precautions by being sure that you wash your hands a lot. You try not to touch your own nose and mouth. Do that as little as possible, because you don't know if you have the virus and you're spreading that virus to other people, on a doorknob or something. By the way, the cleanest place in a public restroom
is
the exiting doorknob, because people have usually washed their hands.
We hope so. Right?
The entering doorknob is dirtier than the exiting doorknob.
Sure.
And that's science.
I don't like to touch
You believe in
anything.
science, right?
I definitely do.
Me too.
I definitely do.
So that's the idea. You don't have to go to extremes. Apparently, there are special masks they use in hospitals and stuff. Actually, they're not shown to be effective in public settings.
Yeah.
So you don't have to wear a mask. It's always a good idea. I mean, we're in earthquake country, right? So it's always a good idea to have a shelter-in-place kit of some kind.
Yes.
So you've got...
I just heard this on the radio today.
Yeah.
Well, if there's an earthquake, if there's a riot, I mean, who knows? If anything happens, you should have supplies in your home to last you for how long?
A week. 2 weeks, until...
Water?
Yeah.
What are some things we might see in our kit?
Well, water, food items that can be stored on a shelf.
Spam.
Yeah, but they got better stuff than that now. So.
Tuna fish.
Yeah, plant-based.
Oh, are you vegan?
I am. Okay. I'm plant-based.
So what would you put in?
There's great stuff that you
hear.
can. Anything that is not in the refrigerator section of the store. So that includes plant-based or non-plant-based.
Baked beans?
Yeah, too. Yeah, stuff like that. Beans, and doesn't have to be canned. There's now these plastic, Ziploc stuff. I hate plastic, but in this case, just to have some, just in case you need it.
Yes.
So anything you can put on a shelf that's not in the refrigerator would be a good food supply. Some water. I forget how much they want. Yeah, stuff like that. But, I have some batteries, so you can run some battery-operated things. And they're even saying now entertainment. Have some kind of something to entertain you for,
Make sure you have Yahtzee.
Period
in
of
your
time. Yeah, that's right.
Would you put Tang?
Game of risk.
Exactly.
There's a new one called Pandemic.
Oh,
scary. That'd be a good one to have.
This dates us both. Would you put Tang in your...
Tang. I guess, boy, it's been so long since I had a Tang. That's
right.
No. It's good, and for the astronauts, it's good for us, right? Just a bunch of flavored sugar.
So what you're saying is just be prepared. You don't need to freak out right now.
No freaking out.
No freaking out.
I think Ebola was worse than this virus. So
it didn't seem to spread as quickly.
Yeah, we contained the spread of Ebola fairly effectively, but that was when Barack Obama was president. So
and not the acting administrators who don't know what they're doing.
Yeah, and they've cut and slashed the budgets of NIH and the CDC.
Yes,
and
we won't go into that too much. I don't think they want to hear about that.
Yeah.
I will just say, look, we've said a lot today.
Yeah.
You have said a lot today. I have learned a lot today, and I hope you guys have as well. Dr. Bill is gracious enough to drive all the way up. We are all better people for having heard the wise words of Dr. Bill. We've learned a lot about Medicare for all. National health care is not something to be afraid of. In fact, it's something to be embraced, not only on the healthcare side, but on the economy side as well.
It makes sense, not just personal sense or community sense, but dollars and cents. So it really, it's something whose time has come. And so I certainly hope that people will get out and vote for the person you think that's going to, that has a solution to those existential crises. The healthcare and global warming are threatening our very existence. And so it's like they say, this is the most important election that we've ever experienced in our lives. They say that every time.
Election of our lives.
Yes, but this one is it.
Yes.
It's that important.
Great. Everybody, thank you to Dr. Bill. I do have some credits. I always forget to read them. So I'm going to thank our crew. First of all, the Argentum crew, including Luca, Mark Labella, Kevin Arriaga, Becca Maddie, Ed at the controls. Thank you, Ed. Right? Yeah. The song at the beginning is a song I wrote from my band. 13, the background cityscape is compliments of Ted Soki, fine photographer. Right? A&I Fine Art and Photography. You saw the studio back there. We are the Harman Press. In fact, union printers. You should always look for the union bug when printing. Yeah. We are Teamsters Local 572. Our shop is number 28. Argentum Studios. We are here in Studio A at Argentum Studios in beautiful North Hollywood, California. Thank you for driving all the way up. Thank you to the gang. Thank you, Dr. Bill. I hope you'll come back again and we can talk about other things. Talk about Bernie, first of all, cruising to the presidency, right?
I'd love to. Anytime.
That'd be awesome. Thank you very much.
Thank you.
All right. Thanks, guys. We'll see you later.